Okay, this is the final installment on psychological disorders. These are the learning objectives for this section, describing just the basic symptom profile of those disorders listed there, and then a few more specifics describing what is meant by positive and negative symptoms of schizophrenia, and then talking about suicide, describe how the following factors, age, the sex of the individual, and previous suicide attempts affect risk. And then reasons for NSSI, non-suicidal self-injury. So schizophrenia first. This affects about 1% of the population. It's a profound disruption of basic psychological processes. Distorted perception of reality. So this is a psychotic disorder characterized by psychosis, a disconnection with reality. There's more than just the typical symptoms. Typically we think of hallucinations, hearing voices. That is part of schizophrenia, but there's more as well. Things like altered or blunted emotion, and cognitive disturbances in thought, motivation, and behavior. I'll post a link to this TED Talk. This is an interesting TED Talk by Elyn. She's a professor of law at University of Southern California, and she has written books describing her experience with schizophrenia. So schizophrenia is a very debilitating disorder, and of course not everyone is able to overcome the challenges associated with it to still be very successful, but it is possible, and I think this provides this video provides a great insight into what this disorder looks like from the inside. Positive symptoms. This is another instance in which positive just indicates math, that these are things that are added to the life of an individual who has schizophrenia. Positive does not indicate pleasant or happy. So positive symptoms are things like hallucinations, delusions, disorganized speech, and disorganized behavior, inappropriate behavior, rigid posturing, loud shouting, and swearing. Hallucinations, of course, are anything but pleasant. They're often scolding, snide, derogatory voices that people hear. Delusions take the form of, they can be, delusions of grandeur, that I am Superman, or I can conquer the world, or they could be delusions that the world is conspiring against you, that the CIA is spying on you, or that everyone is plotting your demise. So those are positive symptoms. Negative symptoms, think of a minus sign. Think of things that are missing from these people's lives. So lack of social interaction, social withdrawal, apathy, lack of motivation. Those are negative symptoms of schizophrenia. There are also cognitive symptoms, which we won't get into, but those are abnormalities in things like working memory and other cognitive domains. Schizophrenia appears to be associated with progressive tissue loss. These are show normal brains, and then brains that show an early deficit, kind of early signs of schizophrenia, and then 5 years later, there's much greater tissue loss. The brain loses tissue with age normally. Synapses that aren't being used, connections between neurons that aren't being used much get pruned back, it's called, and so you will have tissue loss that is just normal with advancing age, but it seems to be pathological in schizophrenia, so that might be part of the explanation for the underlying biology. Okay, childhood and adolescent disorders. We'll start with ASD, or autism spectrum disorder. Communication deficits, like learning to talk later than normal. restricted and repetitive patterns of behaviors, interests, or activities. Things like just rocking back and forth, stacking things on top of each other, organizing things very rigidly, kind of children with ASD may appear to be kind of just in their own world, zoned in on some particular repetitive activity. They also will often have interests that they just really are very passionate about. An autistic young man that I know personally, just knew everything about Doctor Who. He could tell you anything about Doctor Who and Marvel comics. There are deficits in some areas, and then there are areas in which individuals with ASD tend to really excel. Here's an example of someone who's been very successful with autism spectrum disorder, despite the challenges that come with it. Temple Grandin, who's a professor of agricultural science, I believe, at Colorado State University. So this is just a brief interview with her about her experience. She's had books written about her and a movie made of her experience. She's made remarkable contributions to the field of animal science. Just an FYI, the regions that you see here activated, this area is called the default mode network, and it seems to be just these brain regions their activity tends to oscillate in sync with each other when you're just sitting and thinking, mind wandering, doing nothing in particular. Appears to also play a role in theory of mind, inferring the mental state of others. And ASD is hallmarked by delayed development in theory of mind and abnormal brain activity in these brain regions and brain regions associated with theory of mind. ADHD, very common disorder in childhood, and something that can persist to adulthood. About 4% of adults meet criteria for ADHD. Severe inattention, impulsiveness, impulse control, and significant impairments in functioning. Studies do appear to indicate a strong genetic influence, and there are abnormalities evident from neuroimaging studies in the networks involved in attention and inhibition. Conduct disorder. This is a persistent pattern of deviant behavior, engaging in activities such as bullying, aggression towards people or animals, destruction of property, serious rule violations, and beyond just the normal acting out and rebelliousness that comes with childhood and adolescence. This is one that has a lot of different criteria and many different combinations of symptoms that can lead to a diagnosis. But yeah, characterized by this pattern. And interestingly, this it's likely if you have this, then you'll be diagnosed later with antisocial. You're at a higher likelihood of being diagnosed with antisocial personality disorder, which we'll talk about later. So personality disorders, this is an example that I don't know if he's received this diagnosis, but certainly seems like he would fit the bill. Dylan Storm Roof, who shot 9 people in a church in Charleston, South Carolina. He said, "I would like to make it crystal clear, I do not regret what I did. I am not sorry. I have not shed a tear for the innocent people I killed." I was in Charleston when this event occurred. It was definitely a very difficult experience for the city to deal with. Antisocial personality disorder appears to be kind of a criminal personality that people can have. It's disregard for violation of the rights of others that begins in childhood, perhaps with a diagnosis of conduct disorder, continues into adulthood. About 47% of male prisoners have an antisocial personality disorder, so it's very common that it co-occurs with breaking the law. There are many personality disorders diagnoses in the DSM. This is the one that's been most studied, but there's a very interesting list in your textbook, things like histrionic personality disorder, borderline personality disorder, obsessive compulsive personality disorder, which is different from OCD, and some others as well. There's a whole list. Okay, suicide. This is definitely a very heavy topic, but very relevant, and it's valuable to have an increased understanding of this, even though it's still a difficult puzzle that science is trying to solve. Why people engage in this behavior. Just some famous people who have died from this: Anthony Bourdain, Kate Spade, Robin Williams. This is the 10th leading cause of death in the United States. For 15 to 24-year-olds, the typical college student demographic, this is the second leading cause of death after accidents. One of the best predictors of suicide is being male. So about 80% of deaths from suicide are among men. Now, that doesn't mean that men are more suicidal. Women are significantly more likely to experience suicidal tendencies and to make attempts to have suicidal ideations, but they tend to be more hesitant in actually carrying it out, and are more likely to use less than lethal means, whereas men are more likely to use lethal means of attempting suicide. The very elderly are also at greater than normal risk. Interestingly, being white puts you at a much higher risk of suicide. White individuals account for about 90% of suicides. And the best predictor is having made a previous suicide attempt. That's the best predictor of dying by suicide. Just some things that are good to know, not things that'll be on an exam, but if you know somebody who is contemplating suicide, it's been shown that it's better not to, rather than kind of skirting around the issue, to talk directly about it, asking questions like, have you thought about taking your life? And asking direct questions like that doesn't make that person more likely to go through with it. Some describe it as just a relief, to finally be able to talk openly about the thoughts that they've been having. Looking out for each other helps. Lack of social support increases risk for suicide, and having a psychological disorder. So really one of the purposes of the study of psychology is to help prevent deaths that occur as a result of suicide, because having a psychological disorder and not receiving treatment for it puts you at much higher risk. Alcoholics. This statistic I thought was just staggering. 50 times more likely, 50 times higher rate of suicide among alcoholics than the general population. Non-suicidal self-injury is another area that's poorly understood, but this is harming oneself, not with the intent to end one's life, but just harm, things like cutting yourself. It seems to be characterized by strong emotional responses to negative events, and it's believed that self-harm may diminish the intensity. And sometimes it's a way to communicate distress. Just as an FYI, there are cultural differences. Sometimes this isn't really like it's encouraged as a rite of passage, so accepted sometimes.